What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering what it takes to be an X-ray tech. So to give you context, I am a night shift X-ray tech. Been doing it for about 4 years. And if you're new to the channel, because you're looking at this video, what does it take? So being an X-ray tech means you are essentially someone who takes the diagnostic images to help the patient. Either it can be bones, it can be in the main radiology doing fluoroscopy, it can be in the OR doing the C-arm. There's various aspects that our people work at, and this is covering just being an X-ray tech, because the radiology can be confused with CAT scan, ultrasound, MRI, all these other techs. Interventional radiology, there's different kind of techs, each specialize in their own different things. For this video, we are just covering X-ray techs. So essentially what I do, I work the night shift, 7 on, 7 off. And essentially when I'm on, I work 8 p.m. to 8 a.m. There's different schedules. If you're a daytime person and you work 12s, I work in the emergency room. You can do the 8 a.m. to 8 p.m. depending on what kind of positionings and slots they have available. There's the 8 to 4:30. There's the 6 a.m. to 6 p.m. There's different hours depending on, there's the Monday through Friday. There's the 3 on, 2 off. There's, the flip it again. So there's different kind of, schedules of where you work. So essentially what I do every day is I go to work, I clock in. I essentially get report from the tech who's there before me. He'd be like, hey, is everything working? They're like, yes. Is there any exams or anything I should be aware of? Most of the time they're like, no. You sit down, you log in to the PAC system, to whatever system your computer hospital uses. Ours is Epic, and essentially you have your work list and what you have to do, right? And I essentially, majority of the time, I stay in the emergency room and I take chest x-rays for majority of the time, and whatever stuff that, MVCs or traumas that come into the emergency room. And then around midnight, I essentially have a morning port list. Only the nighttime has to do this. You have a bunch of chest x-rays, some KUVs that have to be done on the floor before 5:30 to 6 a.m. for the, doctors and the other people come in to look at their exams. And then that kind of summarizes what I do in that's really about it, just taking x-rays. Now occasionally overnight you have the 0.001% chance, I work at a trauma 3, that you do have to do the fluoroscopy. So for those who are interested and you want to do mainly fluoroscopy, I would recommend doing the daytime. In the daytime, in the main radiology, they do fluoroscopy, which involves enemas, small bowels, esophagams, hip injections, lidocaine, all the other good stuff, which majority of the time you are accompanied by either a speech therapist for the speech swallow exams, or by a radiologist, or by a RPA. Those are the ones who are actually doing the procedure. You are there just assisting, right? Or prepping the patients. Occasionally we do have to do it. In my 4 years of doing a night shift x-ray, I've done 2. I've done a cystogram and I've done an esophagram. Those are the 2 I've had to do. Majority of the times the rads tell the doctors at our hospital, nah, it can wait till the morning. And depending on what's going on, the doctor in the ER will be like, okay, we'll just do it in the morning. Other times they're like, he really, really needs it and we need you to come down. And certain stuff that are more urgent, some of the times it can be CAT scanned and then we don't have to do it, but other times we do have to do it. So it's not a 0% chance that you won't have to do fluoroscopy overnight. So keep that in mind. I do night because it helps me with my kids, and it brings a lot of flexibility that can be done with that field. During the daytime, you do have more techs during the daytime, and it can be more beneficial at times to work in the daytime, because you have, like, if you don't know anything or something goes wrong, you have the people who can fix it, and you both have the supervisors, and you have like veteran techs who've been there for a long time. Most of the stuff that kind of has errors or codes or stuff like that, majority of the times, unless it's a new equipment, someone who's been there has experienced that issue and they can tell you what can be done. So at nighttime, majority of the times you don't have access to anyone unless one of your techs, usually it's either one tech or two techs at night, sometimes it's three, depending how big your hospital is, can have access to that knowledge. And any equipment that fails, unless all the equipment goes down, majority of the times your head honcho boss will tell you, hey, it's fine, just use the other machines. We'll call the people in the morning. Unless every single machine fails for some reason, then yes, they may come and fix it or call someone in to come take care of the business. So, but overall, being an X-ray tech, you're mainly taking images either in the main, the patient outbuilding, urgent care. You can work at the ortho, you can do the C-arm. Essentially, you are using radiation to acquire images the best you can, and depending on what you enjoy, especially if as a student, you would probably look at all the aspects and you kind of pick which one you want. Now, there isn't a single one that comes more superior to the other, because each one is vital and each one has their own ups and downs. I can't tell you, oh, just work in the emergency room and you'll be fine, because that is by its own has its own situations and ungodly stuff that happens over time. And I can't tell you that one place is better than another, because I would be lying to you. Wherever you work at, your machines will somehow be a little messed up, a little broken, out of date. Even the higher trauma level places I've been to, just as because of my kids or because my family members been there and I've seen what equipment they use, majority of the times they are between 5 to 10 years behind, and they're not top of the line. So just keep that in mind. And every X-ray tech everywhere I've been to, and I've talked to them for like a few minutes, they all complain about the same things. And it's literally the same story over every single time, between pay, between the equipment, and between the workflow. So it's kind of like pick your poison, which one can you put up with? Majority of the times it's not really hard. Majority of the times people complain about stuff that it's just like suck it up and do your job. It's nothing crazy. If you haven't actually worked a job that was very physically demanding, you may struggle a little bit. If you're like me, who's worked construction, who's done other hard labor jobs, this is easy. It's nothing. You're in the AC. You shouldn't really complain about much. Even the workflow. Some people who haven't worked any of these jobs, who've just come from like other families who've done just indoor jobs that haven't done, they complain and will be complaining. Majority of the times you'll be surrounded by a lot of ladies, nurses, because the medical field is dominantly women. So you will have a lot of complaining gossip that occurs at every establishment. But at the end of the day, as long as you're doing your job, working, and actually pushing the button and getting stuff done, you should be fine. I am not better than anyone. I have certain stuff that I'm better at, but what I do have is a good work ethic. And in my 4 years of being at my establishment, I could say probably just as far as the amount of overtime I've worked, the amount of I just get stuff done and I don't let it sit, has given me a good slot as far as people want to work with you. Because if you are one of the techs who just slacks and just kind of, talks and doesn't do work, over time, people won't want to work with you, and it causes issues with your work and work-life balance, and it could ultimately kind of get you fired. I, on the other hand, get told I work too much, I work ungodly amount of overtime, and I'm always keeping up with the pace and knocking stuff out, and almost a little bit intimidating to some people. But at the end of the day, I'm like, you come here to work, you take care of business. What more can you ask for? So if you're still here, I appreciate you. I post videos all the time on the field of radiology. Not too many people do, so I'm here to educate those who wish to learn about this beautiful field. I cover various aspects of this field of radiology, and as always, we'll see you on the next one.